So without further ado, I'm going to pass you on to our speakers. And yeah, I think we're starting with you, Jason. So I'll hand over to you now. Thank you, everybody.
That's great. Thanks, Gavin. And welcome to today's session where myself and some colleagues are going to be presenting about improving social work and social care with LGBT young people. So I'm Jason Schaub. I'm an academic at the University of Birmingham, and I've been leading a study called LYPSA. I'm a social worker by background and have been in academia for a while, and my research looks at LGBT young people and the way that social workers and social care workers work with them. My pronouns are he and him, and we're going to introduce ourselves briefly, and then I've got a few more things to talk about in relation to the session for introductions, and then we'll get going. I think the next person to introduce himself is going to be Willem.
Hi everyone, my name is Willem Stander. My pronouns are he, him, and I am one of the research fellows on the LYPSA studies, and I'm going to hand over to Jolie.
Thank you, Willem. My name is Jolie, and my pronouns are she, her, and I am another research fellow on this project, and I'm based at the University of Kent.
So just a couple of things to go through in relation to the study. We will be joined in a little while from one of our young advisors, Omar Mohammed, who is a practicing social worker. So you'll all be very well aware of the challenges that entails, which means he's probably going to be a few minutes late. And we also had contribution from Professor Paul Montgomery, who's out of the country, so can't be presenting with us today. LGBTQ plus is going to be used across this presentation, and that stands for lesbian, gay, bisexual, transgender, queer, and questioning. And then the plus is for everything else around sexual and gender minorities that comes underneath of that. It's the widest sort of version of the rainbow umbrella, if you want to think of it in relation to that way. I also want to point out that this study was funded by the What Works Center for Children's Social Care. We're grateful for them for the funding that they've provided and the support that's enabled us to pull together these three different studies that we're going to be talking about for today. So looking at the project overview as the next thing that we're going to be talking about. So across this study, one of the challenges that we found before we started is how little attention has been paid to LGBT young people in social care, both in practice and then in research and in policy. And as a result, one of the things that we wanted to identify was our own way of thinking about this and engaging and trying to address those knowledge gaps. So the aim of what we did across these three studies is to improve the social care experiences of LGBTQ plus young people. And that was an important sort of goal for us to have throughout the study, and was sort of a guiding principle from beginning to end. And you'll see how that entails itself across the different studies that we'll be talking about. It's both collaborative and co-produced in all the senses of the term. And we had a group of young advisors, one of whom, like I said, is going to be presenting with us later on in the session. But there were three other young advisors that were connected to the study. We also had a stakeholder group that included people from social care support organizations such as Social Care Institute for Excellence and LGBT support organizations. And we also had experts by experience that were connected to the stakeholder group. So this project has three parts to it, and we'll be going through it in chronological order, but also in order of sort of what sort of makes sense to us as researchers. And so we're going to be talking about these in different pieces as we go through this evening's session. The first study was an international scoping review about LGBT young people and their social care experiences. And that's just looking at all the literature. So I had a colleague of mine who used to describe the job of an academic to go and read all the things that practitioners don't have time to go and read. And so that's what we did in this study, is we went and read all of those papers that we completely appreciate the people that are busy out doing home visits and doing the complicated business that is involved in social work every day of the week don't have time to read. And then we compiled it together and we assessed those pieces of research to find out whether we thought that they were good and what they could tell us and what we could learn across them. So we compiled all those things together. The second study was a series of interviews with LGBT young people. And those interviews were about their experiences in residential social care. So this is predominantly group homes, but also supported independent living and things like the YMCA and other places like that that you'll be familiar with. And nobody else had ever done a study like that where people had interviewed LGBT young people in residential social care. So we were quite pleased. Going into research means we like to be a little bit like explorers and find out what other people haven't done. So we were quite pleased about being able to do that. We built on the work of other people. So Jeanette Kosar's work at University of East Anglia was one of the studies that we built on that had done quite a lot of work around LGBT young people in foster care. And so we were quite pleased to be able to develop on from that. And then the third study that we did, which was the longest from a time perspective for us, was we tested an online LGBT knowledge package for children's social workers. And we used something called the randomized control trial. And we'll explain what all of those things mean and why you should be interested in them if you're a practicing social worker. And so on to the next slide, if I'm right. So if we look at these methods that we've got here, on the right-hand side is the attractively rainbowed pyramid that talks about what we call in research the hierarchy of evidence. And whilst some people disagree with the use of this, the fact of the matter is that policymakers accept it. And so one of the things we wanted to point out is that this is contested, but there is some evidence to support the fact that some studies are accepted and seen more by policymakers. And so our study sat within this. And so you'll see randomized control trials as the sort of lavender colored, which I have to say, we didn't color these. We were quite pleased to be able to find one that aligned with some of the things we're doing. And that's where one of our studies sits. And a systematic review at the very top, we used a systematic scoping review. So it's approximately in that sort of area. And that gives you an indication of the fact that we were doing some of the most rigorous methods that are available to social care scientists. That means that these methods are evidence-based, so they draw from that sort of side of research knowledge. And we created protocols, which means that for each one of these studies, we wrote what we were going to do before we did it, which meant that we didn't deviate from what we said we were going to be doing at the start. So that is one way of doing research. There are other ways of doing research as well. But one of the things that these types of approach do is they argue about attempting to reduce the bias from us and the other research individuals within creating, designing, and then undertaking the study. Those protocols and other ways that we were working through the studies have been co-produced. So that means that we took them to our stakeholder groups and our young advisors and said, what do you think of this? And when they told us that they didn't think that the choices that we were making were good enough, we went back to the drawing board and came back to them and actually asked for their opinion about a range of these things. And so that was a useful way of sort of constructing the study. I'm now going to hand over to Willem, who's going to talk about the first study from this project.
Thank you so much, Jason. So yes, I'll be discussing the first study that we conducted as part of this project. So we did a systematic scoping review of the international research literature that is out there on the topic about the health and well-being experiences of LGBTQ young people in foster care and also in residential care. So we assessed the quality of all the studies that we shortlisted to include as part of this. And we took a look at both articles published in journal articles, or in journals, sorry for that, and then also reports, and we assessed the quality of these studies. So we only included medium to high quality studies as part of our review, so we can be very confident in the findings that we have here. We ultimately ended up with 22 studies, and what stands out from this is that, number one, there is very little research in this area, and most of it varied in quality. Most of the studies came from the United States, so about 77% of the studies that we included as part of this was from the US, with a few studies conducted in the UK. If memory serves, we had 4 studies specifically from the UK. And as Jason mentioned earlier, one of those studies is from the work of Dr. Jeanette Kosar and her colleagues at the University of East Anglia. It's a really foundational study here in the UK. Again, it looked at the experiences of LGBTQ young people in foster care and was the foundation for the work that we did moving forward. So what did we find as part of the scoping review? Well, some of the other findings, we found out that LGBTQ young people are more likely to end up in care and to end up in residential social care especially. So when we look at some figures around that, the estimates that we have is between 15.5% and 30.4% of young people in care identify as LGBTQ. Now, LGBTQ young people enter care for the same reasons as non-LGBTQ youth, so that's abuse and neglect, but there's an added element to this. So quite significantly, a big difference is that a lot of these young people experience rejection and harassment from their families and caregivers around their LGBTQ identities. So that's one of the reasons they were more likely to end up in some of these settings. That's important to keep in mind when we think about young people. Their first port of call is often their families and communities. So if it's likely that a young person has issues with their families or difficulties with their families, they're likely to have issues with their kind of wider community as well and the wider family setting. What we also found was that they experience more placement moves and longer duration in care because of some of the rejection that they face. They also face heightened educational challenges, again, because of these more placement moves. And then very worryingly, obviously, is we also found very poorer health, mental health and well-being outcomes compared to their non-LGBTQ peers in care. So some worrying findings that we have there. I'm going to move on to the next slide. Hopefully that is showing for everybody. So 3 groups that we found faced very significant challenges. So those from racial ethnic minority backgrounds and lesbian and bisexual girls were more likely as part of that wider group to end up in care. And then also we found that transgender and non-binary young people faced quite significant challenges as part of their care experiences. We also found that LGBTQ young people are more dissatisfied with their care experiences than non-LGBTQ youth, often because of the discrimination that they face in these settings, not only from their peers, but from social care professionals as well, so social workers and residential workers, and then also from their families and in wider society. So there was also a greater risk of homelessness and exploitation after leaving care, also more survival sex for food and shelter. We also found that social workers and carers reported a lack of adequate LGBTQ knowledge or training in this area. And there was also some evidence of homophobic, biphobic and transphobic attitudes that we found in the literature as well. There was also very few policies protecting LGBTQ young people from discrimination. And again, you can see this as part of Jeanette Kosar's study. So the reference for that you can find in this scoping review, and we will be sharing links to that a little bit later on. Some other findings that kind of stood out from the scoping review, in addition to that lack of training, there was also, as I said, we found that a lot of these studies very much focus on the experiences of LGBTQ young people in foster care, which really nicely sets up the second study that I'm going to share with you now, where we did interviews with 20 LGBTQ young people about their residential social care experiences across England. So they range in age from 16 to 24, and this was the first study in the UK to really focus on their experiences exclusively. So what do we find as part of this study? Well, there were some positive experiences, but across the sample, LGBTQ young people reported a difficult time in residential care because of the treatment around their LGBTQ identities. There was also widespread evidence of homophobia, biphobia, transphobia from their peers, from placement staff, from social workers, and again, their families. But what we also found was that there was quite a bit of gender policing that was going on as well, especially for trans and non-binary young people, so discrimination specifically towards their gender identities. Again, we saw the evidence that was kind of in the scoping review as well repeated. There was a lot of discussion about multiple disruptions as part of their care journey. So again, multiple placements, high staff turnover, and having a real difficulty trusting new caseworkers coming in onto the scene really and having to form those bonds again. And as a result, many of the young people we spoke to had to hide their LGBTQ identities and new placements just to see if it was kind of safe for them to come out to someone. And what this obviously does is it reduces their connections to support, and it also increases their isolation. They were also coping with unmet mental health and sexual health support needs, where they needed much more information and kind of signposting and support, which they didn't receive. One of the other things that really stood out to us was that the young people we spoke to also really valued and stressed the importance of affirming relationships with social workers, with residential workers and other care professionals. So what do we mean by that? Well, it is relationships that affirm their LGBTQ identities, not only respecting these identities, but also celebrating them and really advocating on their behalf. I'm now going to hand over to Jason, who's going to discuss the participant demographics for the second study in a bit more detail.
Thanks, Willem. And just before I talk about the participant demographics, one of the things that I just want to point out about the difference between these two studies, because I realize we're moving between them really quickly for you, is that we looked at the range of available evidence in the first study, and that helped set us up for what we wanted to look at in this second study. So we wanted to identify what we didn't already know about. And one of the things about that is around the idea that most of the knowledge has been generated from the United States. And you can tell from my accent that I'm not originally from the University of Birmingham area, but that doesn't mean that I suspect that American evidence is better. In fact, there are complications about translating it without sort of contextualizing it. So we wanted to see about how those pieces of knowledge, whether they test out here and whether they sort of make sense in a British context. And so when we think about the second study, that is essentially what we were talking about doing. The second and the third studies are answering gaps, things that we don't already know about in the knowledge, and trying to address what we see as key questions for social workers to improve services. That's the whole goal of what we're doing. This isn't knowledge for knowledge's sake. It's trying to make social care better for LGBT young people. So thinking about this second study, so the qualitative study with LGBTQ plus young people that were in residential care, we talked to 20 young people, and you can see a table here on the right-hand side of the screen. And what you see is an amalgamation of all of the young people that we talked to, and trying to show you the representation of how they sort of were grouped or they were able to be identified. And what we see is that there was a diverse group of young people from just about any way that you could think about orientating it. So if you think about sexual orientation, we had, again, a wide range of LGBT young people. So you had a high proportion of bisexual. And again, this mirrors broadly what we see in LGBT young people that are in care, depending upon the studies that you're looking at. When we looked at gender identity, we had a greater proportion of cisgender young people, but we had a relatively high proportion, 35%, that identified as trans and or non-binary. Again, that matches, maybe not the percentage-wise, 35%, but there's a higher proportion of trans and non-binary young people that come into contact with social care services than in the general population. And secondly, when we think about across the age range, when we're talking about young people, there are currently higher proportions of young people that are LGBT that are identifying as trans or non-binary than there are for older people. And that's a facet that sort of is reflected in the demographics we've got. We were also very pleased about having over 50% of the young people that we spoke to that come from ethnic or racialized minority groups. And that was important for us, given the historic and sort of typical underrepresentation that they have faced within studies in relation to LGBT young people specifically. Generally, LGBT young people studies are overstacked with generally tend to be white, cisgender, middle-class young people. And so we were quite pleased about the fact that we had a broader diversity of young people. The age range there, you can see 14 of our young people that we spoke to were between the ages of 16 and 19. And then we had a few of them, a smaller proportion of them, that came between the ages of 20 and 24. Now, those 20 to 24-year-olds were reflecting back on their retrospective experiences, as opposed to talking about things that were happening currently for them, even though some of them could have the opportunity of living longer in care, as we know, depending upon what their sort of care experiences are and whether they remain in continuing education. When we then look at the demographics of where they sort of sat across the country, what I was particularly pleased about. So I cut my teeth in London in doing social care practice across several different London local authorities. And one of the challenges of doing research of this kind in the UK is that they become very London-centric, and it means that the rest of the country, their experiences aren't reflected often, or that they can be marginalized or challenging to sort of gather. And also it shows that we didn't just recruit from young people that are on a doorstep. So whether West Midlands didn't even get as much of a look in as the rest of the areas. And I think that's a real strength of the study about showing the diversity of experiences across the country. And so the next slide is the first set of quotes that we've got for today around the second study around the LGBT young peoples in residential care. And I think the important thing about this quote, and the reason I wanted to talk about it for a couple of minutes, was to say I have huge sympathies for the work that social workers do. It's a challenging, demanding job. And I remember, in fact, I was just on Tuesday talking to a group of social workers that were working in practice, and we're listening to their experiences that they were telling me. And so when I came to the study, I felt like I had a pretty good indication of what I would see as normal practice and things that would be outside of that. And I found some of the stories that we were hearing harrowing and unusually difficult in comparison. And we found them repeatedly across the 20 young people's experiences. So we need to be clear about the fact that these, whilst these are isolated quotes that we're giving, we don't have the time to go through all of them, these are indicative of the rest of their experiences in some form, and they might be highlighting particular issues, but there were other examples that were just as harrowing or indicated. And this is especially around two elements. So the intersection of placement and academic disruption for young people. So the number of placement disruptions that these young people experienced, I would have been unusually high in comparison to the practice that I experienced. And also from the research studies that I've done with social workers since that point in time. And this young person told us this story about when they were moving from one part of the country to another. And they said, when I was doing emergency placements, I would go to a place for the night, then my social worker or one of their colleagues would pick me up in the morning, and then I would spend the day at the social worker's office, and they'd try and give me a bed by 8 p.m. that night. And just to point out, from my own experience, I know that this experience happens for social workers. If we're struggling to find a place for a young person, then they might need to come and spend some time at the social worker's office, and they might have an emergency placement for a single night. And we know that that happens. But this young person had a particular experience, and they go on to say that went on for 6 weeks every single night. And apart from some weekends, I got to be there for a couple of days, but literally every day a different care home or foster home. I was going from one side of the county to the other every day. I spent extreme amounts of time out of school. And so the other challenges about this that show from this is when placements are disrupted in this sort of circumstance, we know, of course, that that's going to have an effect on young people's engagement with academia and their ability to go to school. But what's important about this group of young people is that they had a higher amount of placement disruptions, as we showed in the scoping review earlier on. And these young people were telling us that they had more placement disruptions. Some of these young people point to the fact that they think that the number of those placement disruptions or placement moves were a result of being LGBTQ. And that points to the fact that we might want to be thinking about how we think about services and constructing them. I'm going to hand over to Willem, who's going to talk to the next couple of slides.
Thank you, Jason. We're going to be sharing a few more quotes with you from across the sample. And this next one, again, to kind of echo what Jason said about multiple placements and the placements disruptions that they encountered, this had a profound effect on not only their health and well-being, but also their access to services. So as you can see from this quote, this was from a trans young person that we interviewed. I'm on the gender identity clinic waiting list. I need to fill in my paperwork and send it to them with my address, but I don't know where I'm going to be living. So I can't do that until I know where I'm going to be staying. It's the same with adult mental health services. It is the one problem that stems into everything else. We have another quote that I'm going to share with you. We found some really excellent examples from care professionals and social workers about supporting trans and non-binary young people. So examples of that includes referring to them respectfully with the correct pronouns, using the names that they have identified as affirming their identities, interacting with healthcare professionals on their behalf to instruct them about what pronouns to use. So loads of really good examples from the data that we found, and we'll discuss a little bit more some of those in just a second. But more often than not, there was quite often quite some malicious cases of misgendering, and also there was evidence of poor knowledge of trans and non-binary identities among professionals. So as you can see from this quote here, there was this new staff member, this is specifically referring to a residential worker, who would often misgender me to other staff members. If there were residents around when he was doing that, he would be placing me in a dangerous situation. The young people we spoke to also talked about their concerns being minimized, and especially their emotional distress. So as you can see from the rest of that quote, I wrote a complaint about it, but it was never seen through. I spoke to the manager, but she basically just said that I was being difficult. So those were 3 quotes there from study 2, and I'm going to share some good practice examples with you next that are recommended for social workers to undertake in this context. Now, these come from the first 2 studies, so that's the scoping review and the qualitative study about young people's experiences of residential care. But also we developed these in discussion with a young advisory group on the project. So these are some of the key recommendations that we have there, and I'm going to jump around them a little bit because they interconnect quite a lot. One of the main things is really to proactively support and positively, I can't speak today, my apologies, positively support and celebrate the LGBTQ identities of these young people. So talk about some examples from the interviews that we did. We had a young person who discussed their caseworker taking them to their first Pride experience and really celebrating them in that way. We've seen some other really great examples when it comes to not assuming heterosexuality and or gender identity, especially when you're meeting the young person for the first time. As we've said previously, a lot of these young people often hide their LGBTQ identity, so they were on the lookout for very subtle kind of cues or signs that made them feel like, or made them aware that it was safe to come out to the person that they were in contact with. So what are some of those signs that you can essentially do? Well, we talk about LGBTQ inclusive signals and cues. So having LGBTQ related posters up in the residential home, wearing rainbow lanyards, LGBTQ ally badges are also a good thing. But young people were very much aware in instances where they felt that some of this was quite tokenistic. So they discussed that with us quite a bit. So again, it really comes down to how you interact with these young people and not just having visual displays everywhere, but using gender neutral language, asking the young person how they might identify, introducing yourself using your pronouns. A very easy way of doing that is as part of your email signature, just to have your pronouns at the end of your name. Again, that's a very subtle kind of clue that you can give a young person to identify that you're an LGBTQ ally, and it would be safe to discuss some of these things with you. Also, other examples include visibly challenging homophobia, biphobia, and transphobic bullying in some of these care homes, not only from the young people, but from other workers as well. There was also a lot of talk about their coming out experiences and how sometimes this was minimized or seen as attention seeking rather than an ongoing kind of fluid process where a young person might identify in certain ways, but their language is evolving as they start recognizing what kind of terms affirms their identities and then respectfully using those as they do. The other thing that we kind of recommend is connecting a young person to LGBTQ resources. This was something that really stood out to us, where people, social workers and caseworkers, the examples we were given, just didn't know what kind of resources were available. And to really have like a backlog of these kind of in your back pocket to know about some of these organizations that might be useful for a young person, and not only to signpost them, but to consider some of these resources with them is also really quite important. It's important to be mindful that even in some of these LGBTQ settings, which are really incredibly supportive and great communities, there might be some discrimination there just because the young person identifies, or well, as a care experience young person. That's what I'm trying to say. So there's some really good practice examples there for you. Now, we understand that some of this might require some additional knowledge or skills from social workers. We have some ideas of how you might be able to resolve that, and we're going to discuss that in just a little bit when it comes to the training, which is coming up later. Jason, I'm going to hand back to you to discuss the model from the second study and the scoping review.
Yeah, thanks for that, Willem. So one of the things that I want to point out was, in addition to those good practical examples that Willem was talking about, is the young people were telling us about the importance of the individual important relationship with social workers. And I want to stress how important that is to the young people that we spoke to and the young advisors that we worked with. So I think if you're anything like me, that gives you quite a lot of hope about the effect that social work can have on a young person's life. And there's some really great work done by Sue Westwood and some of her colleagues at the University of York about celebratory work with LGBTQ plus people across their lifespan that can be applied in this space. So not just being tolerant within the British attitude towards that, or even affirming, which has been one of the recent sort of things that's been coming out about LGBT affirming work, but actually celebrating that. And that point that Willem is making about going to the first Pride or other sort of ways about saying to a young person, not only is this something that we're going to put up with or we're going to work with, but actually this is, you're excited about this and we're excited about this for you. So the model that we've developed as a way to help social workers be thinking through this is represented here. And I'm going to start on the top left-hand side of the screen and going to sort of move in a clockwise sort of manner for you. So the pathways into care are really important here. And young people that are LGBTQ plus come into care for different reasons than some of their peers, and that's important. One of the things is that it's often related to their sexual orientation or gender identity or expression. And that sometimes is connected to abuse, and it's often connected to rejection, whether that's perceived or real from the family that the young person experiences. What's important about this is that if the young person experiences rejection from the family, they're often going to assume that they're going to experience it from the wider family and from the wider community as well, in comparison with other minority groups. And as social workers, one of our first port of calls is to look to the wider family and the wider community, and that's a challenge. There's often poverty influences that relate to this, and familial mental health and substance abuse issues. And again, these are constant sort of backdrops, or frequent backdrops, if you will, into the types of work that we undertake. If we think about the social care sector factors that are sort of influencing the young people's experiences when they're here, that includes placements. We've talked about unstable or changes in placements that are quite frequent. And often, the other thing we wanted to point out is whether those placements are inclusive or exclusionary. And if you look just for a moment on the right-hand side of the screen, that shows how some of these different social care factors can either be affirming or helpful, or non-affirming or challenging for these young people. The relationships between peers and care professionals can either be supportive or discriminatory, and those had a huge effect, like we were just mentioning, for young people's experiences that influenced how much they felt about being out. So the placement, whether it was inclusive or exclusionary, and the relationships. If they had a social worker, for example, that was willing to talk to them and support them about their LGBTQ plus identity, they felt more able to be out about themselves. The important thing about that is when they're more out, or they're able to tell people about their LGBT identity, they're then able to access tailored and relevant health and education elements for what they need. And that's important in this sort of circumstance. So they don't necessarily need to be out to everybody at all times. That's not what we're suggesting at all. But it's helpful if they are able to talk to some people about their LGBT identity. These all sort of relate also to the young people's resilience. And what we found across the young person study, the qualitative interviews that we did, was the incredible resilience that they showed, and their ability to maneuver, navigate, and manage their care experience was, I was truly impressed by their ability to construct the scenarios around themselves that they wanted. We need to point out the sort of structural issues that relate to this. So that includes LGBT training and policies, the high staff turnover that I don't need to tell you is a challenge in the workforce and the experiences, barriers to health and education professionals, so challenges about accessing those things. And then austerity. We've not only had one experience of austerity in the post-2008, but we've got austerity 2.0 that's currently going on. And again, I don't think we need to be telling you about those experiences, but those do have an effect on the ability for services to be providing supportive and affirming experiences for LGBTQ plus young people in residential care. There are some intersectional issues that relate to that include issues around racism, sexism, ableism, and classism that were found across this, and those need to be taken into account as you're engaging with LGBTQ plus young people, so that as they might have more intersectional minority identities, that those can complicate and make their experience more challenging, that we need to take account of those things. The last thing I want to talk about is this, this sort of teal colored square on the bottom left-hand side of the screen, which is to be clear about the fact that as young people transition from care, and they either go into care leaving services or independence or connect to adult social care, they carry with them these range of experiences. And I know that seems quite barned or obvious, but it's really important to think of the fact that a one young person may have a supportive, affirming relationship and have a professional that supports them and a placement that says that it's great to be LGBTQ plus, and that's going to be their experience. So when they leave care, they're going to have a more positive self-identification. Whereas another young person that comes in with the same exact experiences, if they have challenging placements, they've got greater placement moves, and they don't maybe have an individual who celebrates or supports their LGBT identity, they're going to come out of care with a greater amount of challenges. And actually, they've been able to point out to us that those are a consistent sort of challenge that they experience. Looking ahead to the other things that we wanted to point to for the next set of the studies on the next slide is, so I just want to spend a couple of minutes on this. So if you're anything like me, your eyes are immediately sort of a little bit dazzled by the QR codes. And these QR codes relate to the first study. So that's the article in relation to the scoping review. And the second one on the right-hand side of the screen is for the qualitative report. Both of these are freely available, so anybody that's got a computer and internet access can access and read those. We've done that deliberately because I'm aware of the fact that people that are working in practice often struggle to access resources when they've been produced by social work researchers like us. There will be an article that will be coming out about study 2, and that will be available, and that will also be freely available. So if you take your phone up and you take a picture of one of those, they'll take you straight to either one of those documents, and then you can take a look at them. I always say I'd be delighted if you downloaded them, printed them off, and then wallpaper your bathroom with them, because that makes us happy as researchers. But also, these studies shouldn't be meant to sort of sit on a shelf and gather dust. These are only going to be useful if people are using them in practice. And we've given you a smattering, a little bit of a taste of some of the things that have come up, but there's a whole range of other sort of content in them, and that actually support the things that we've been saying, that show why we've come up with the ideas and the statements that we've got that are in there. My hope is that we've got Omar that's able to be here for this and has joined the session, if I'm right, because I think he's entered the session. I'm hoping he's going to present about his young person experience next, which is that one of the things that's important about this is that we're engaging with social workers that are currently working in practice and that are young advisors, and that means that their engagement is going to be a little bit different than what we're able to do. Omar, really great to have you, and over to you.
Thanks, Jason, and yeah, apologies to everyone for being late. Had a bit of an emergency to deal with, but I'm here now. So yeah, hi everyone. So my name's Omar Mohammed. I'm one of the young advisors on the LYPSA studies. So I'm one of advisors. Friends for the researchers in the study. So what that means is we kind of have regular meetings with the research team, and we kind of give our perspective of kind of young people, LGBTQ plus young people who have had experience with social services and kind of care experiences, and to kind of share our kind of lived experiences and our perspectives on kind of what the research team are doing. So this includes things like, so in study 1 and 2, we helped in terms of the analysis, some of that kind of early information coming in. We were kind of thinking about, you know, from a research lens, you know, this is really great, kind of what the research team thinks about this based on the knowledge that the researchers hold, but actually from our lived experience perspective, it was really great to kind of help understand some of the information that was coming through. We were involved in kind of refining the interview questions. So I think it's really important that, you know, in terms of co-production, you know, we were able to give a perspective on how some of those questions would be received, and kind of putting ourselves in the shoes that we're quite comfortable with, being able to kind of reflect on how better to ask those interview questions. So that was, I think, really useful for the study. And we were able to start to kind of advise on those early themes that were coming through. And kind of making sure that those themes were relevant to kind of our experiences, but also our kind of understanding of you know, kind of being a young person that's LGBTQ plus in care. And then in terms of study 3 and thinking about our future involvement, so we've been kind of helping around the kind of recruitment drive of kind of the study 3 in terms of making sure that social workers are engaging in the learning package that's offered within study 3, and then also being involved in some of that further analysis, ensuring that kind of that information that's continuing to come through that you've kind of seen in the presentation already today, that we're still giving that very much lived experience and kind of expert by experience perspective. We're also looking at things such as like a journal article around our kind of experiences of being a young advisor. And I guess a little taste, you know, just to say that it has been amazing, you know, to be a young advisor and to give that perspective and that experience on such an important study. And I think it's a real staple for how I think all research studies, you know, going forward should really be conducted. You know, having the, you know, the kind of the pool of people you're trying to research, you know, kind of involved in, and kind of being kind of having that strong voice, but also critical voice, and that being welcomed. You know, I think criticism being welcomed is constructive criticism being welcomed is a really positive thing. And I think, you know, hopefully with that journal article, we'll be able to kind of share some of those findings, and a few other things we've got going on in terms of going to conferences with the research team, and being able to kind of have those great experiences. And things like kind of advising on other kind of outcomes, so like an animation, and we're doing kind of lots of work around kind of making sure that that's relevant and that's accessible and that sort of thing. But yeah, being a young advisor has been a really great experience, and I think continuing that has, you know, within the project has really led us to a place where we've got a project, we've got some research, we've got some knowledge that is, I think, really well evidence-based, and is really meaningful as well. And I think that's what's really important for me, is that it's really meaningful for young people that are LGBTQ plus in care. Thank you.
Thanks, Omar. I'm inordinately proud of the work that the young advisors have done, and can't take any credit for it. They've worked incredibly hard on the project, and we've been really pleased. And I think one of the points that I want to draw out about the young advisors and their connection has been the development across the life of the project. So it required an element of trust from them in us that developed over time for us to be able to say things, and also for us to be able to say, really, we are asking for you to be critical and tell us things that aren't working. So Omar mentioned an animation that's coming out about study 2 to describe young people's experiences. And can you imagine if I wrote a script for an animated video about young people's experiences? That's going to sound like a gay American that's been transplanted to the UK, and not at all related to the way that young people would talk about their own experiences. So they've been really helpful about showing to us how to describe things and how to point things out that are more relevant and related to their experience. So thinking about the third and final study of our evening, and you'll be pleased to see that you're in the home stretch of the studies that we've been doing, and we're quite pleased about the fact that we're at our final of our 3 studies over the last 2 years. So this is an evaluation, and we tested an e-learning module that is around LGBTQ plus knowledge. So what's important about this study is that we took a study that was already, or an e-learning module that was already widely accessible and used across the sort of sector. So not everybody was using it, but it was quite popular across it. So it was CPD accredited, and it took about 2 hours to complete. And it was what's called a trial, which means it was just an experiment. And that means that we divided people into 2 different groups. One received the training, and the other one received what we call business as usual. And that means that if they had received EDI session as a part of their ongoing experience in the local authority, then that's what they would get. If they had an external trainer that came in to do something, that would also be normal. And this is a normal way of doing a trial like this. So if you think of this would be based off of like a medication trial, for example. One group would get treatment as usual, and another group would get a new intervention to see whether there's a difference between the 2 of those. The other thing that we did is what's called a pre and a post test. And so that means we gave both of those groups a set of surveys that tested 2 main things. One is around LGBTQ plus related knowledge, and then the second one was around attitudes towards LGBTQ plus people. And we wanted to see a change in those scores in relation to that. And our final speaker for tonight, Jolie Kiemink, is going to walk you through that because she is a stats whiz, and you want her to be able to talk through those things as opposed to me. Before she does that, I've got a brief little talk about recruitment, because we're quite excited about the fact that the recruitment, and I just want to point out about how hard everybody worked about getting recruitment up. And you can see the change that happened in about November, where we attempted to be like the Kardashians and spend quite a lot of time on social media and influence. And it shows the effect that you can make when you change and use a different strategy. And also about the hard work that I know that the Principal Social Worker Network, as well as some of the other social work support organizations, were trying to get people to be involved in this. So handing over to Jolie for the next set of slides.
Thank you, Jason. Yes, so as Jason mentioned, we conducted a randomized controlled trial, and this particular trial was called a pragmatic trial because it was taking place in the real world. So we didn't take people out of their jobs and isolated them, but it was taking place during their actual working days. And what was really good about the training is that people could complete it in their own time, and they could complete it over multiple sessions, so they could log on and log off as suited them. And what we were interested in finding out was whether the training had an effect on knowledge around LGBTQ plus youth and their support needs, but also if it had an effect on what we call heteronormative attitudes and beliefs. And heteronormative basically means that we see heterosexuality as the norm and as normal, and that's what we assume and see as normal in the world. So participants completed a pre-test and a post-test, and we were looking to see if there was a difference between the control group and the group receiving the training. We also collected some other characteristics of participants, including the connection to the LGBTQ plus community. So for example, whether they had a friend or a family member who was LGBTQ plus, or whether they were LGBTQ plus themselves, religiosity, their age, the years of experience in a social work profession, their gender identity, their sexual orientation, and whether they'd received any previous training on LGBTQ plus support needs, whether that was internal or external. Next slide, please. So then the results of this study, we examined the effectiveness. We used several analysis approaches. I won't bore you with those stats details, but we used several analysis approaches to basically demonstrate whether there was an effect for all those different analysis approaches, because that makes the results more robust. And we did find an effect for all those approaches. The good news was that the e-learning training module was effective. on both outcome measures. So in terms of heteronormative attitudes, the training was effective at decreasing those attitudes. So people who were in the intervention condition had lower heteronormative attitude rates compared to the control condition on the post-test. And it was effective at increasing LGBTQ plus knowledge. So people in the intervention condition who underwent the training had scored better on the knowledge measure compared to a control group. We also had a look at some specific groups within our sample. So for example, we split the groups in terms of how many years experience they had in the profession, and what their own sexual orientation was, what their gender identity was, their connection to the community. And we found some preliminary evidence that the training might work best for people who are relatively new to the profession, who identify as straight themselves, which might sound surprising, but that can, for example, be explained by the fact that people who are LGBTQ plus themselves already have quite a high level of knowledge and a low, would score low on heteronormative attitudes. Who are a woman, can have a connection to the LGBTQ plus community and are over 35 years old. But this evidence is preliminary because once you start looking at separate groups within a larger sample, those groups become smaller, and to conduct robust and reliable statistics on those groups, you need to have quite a large sample. So they're just indicative of things that we could look at in the future. We also looked at what participants found going through the training, if they found a positive experience, and overall participants were very positive about the training, and most importantly, they felt confident after completing the training that they were better able to support LGBTQ plus youth. So overall positive outcome. I'm handing back over to Jason now.
Thank you for that, Jolie. That was really helpful. And one of the things to point out is about the size of this study. So having 614 social workers that are working in practice that stayed with us across the months of the study was an unusual thing. I don't think I've ever been involved in a study of this size in this, and it's unusual to see it in social work in the UK. And I think we want to really say thank you to the people who took part in the study, and also to say that, you know, it's unusual to get that much sort of buy-in, and that was, I think it points to how much interest there is in this study, or at least that's what I think of in the dead of night when I'm woken up in a blind sort of panic about it. So some of the recommendations to point out about this that came out of the study. So you won't be surprised that we would be suggesting more training, because if we found that this training was useful and effective, and social workers, you remember all the way back to the beginning of the evening where we talked about the fact that social workers were saying to us that they needed more training about this. We then went out and tested a training package, and we found that this training package works. It does what we want it to do on the tin. And we also suggest that that training should be mandatory, so that all social workers should receive that. Because one of the things we found was that lots of LGBTQ plus young people aren't telling their professionals that they're LGBTQ plus, which means that it shouldn't only go to those people that are known to be working with this group of young people. We think that that training should be easily accessible, which probably should mean in the start, it should be an e-learning package. It should be low costed, and it should be effective, obviously. But we also think it needs to go one step further than just being an online training package, that it needs to include coaching or reflective supervision, something to help social workers put that into practice in their ongoing practice experiences, to see whether they're able to sort of put those into effect and see if they work, see how they manage that. We also think that there needs to be targeted and nuanced policies to reduce discrimination. So young people's experiences are telling us that they have challenging experiences in social care, and that means that policies within organizations and more widely need to sort of identify that this group of young people have particular needs that aren't necessarily being addressed by the experiences that they currently have in social care. If we move down to the bottom left part of the screen, improving placement stability is a real issue for this group of young people. And we think that part of that, given the experiences of what young people were telling us, as well as the scoping review, we suggest that we would assess the attitudes and competence of professionals and foster carers about their engagement with this group of young people. Young people are telling us that some of the people that they're working with are either heteronormative, or indeed they could also be just flat out homophobic or transphobic towards them. And that means that we need to think about the professionals and the foster carers that are working with young people. Again, remembering that not all LGBTQ plus young people are telling us that they are part of that, the rainbow umbrella. And so we need to be thinking about all foster carers and professionals that are working with them. And then the last of the recommendations that we're making, and there's more, and there's support for why we've been making these across these 3 studies, is the contribution and the importance of care experienced LGBTQ plus young people in service development. So making sure that when we talk and think about service development and changes to services, that we're talking to and listening to the LGBTQ plus young people that are connected to our services, and how that means what they think needs to be done differently in relation to them, and asking them to suggest and make changes to the way that things should be happening. If we think about the last bit of information that we've got for you in relation to what we're thinking about, here's some further information about what you can find. Here's another one of those eye-watering QR codes on the right-hand side that'll take you to the project website that talks about all of the different sort of outputs that we've created for that. Omar mentioned an animated video that will be available there. You'll be able to see that on YouTube, and probably I'm hoping to get it on Apple TV if I'm able to get my my deal with Apple organized in time. That, by the way, is a huge joke. I must say there isn't a deal with Apple in the works. But there's also contact details for all of us that are there that you can be able to use in case you've got questions for this. And we hope you want to engage with this this study and the engagements. We've got a set of question and answer for the next couple of minutes, but I just wanted to point out a couple of thanks before we move on to that. Firstly, to Gavin Mohan for the introduction, the assistance, and across the range of this sort of session has been really, really helpful. Philippa Geddes and Catherine Hewitt from Social Work England have been incredible all the way through it about assuaging. We might look like this is a seamless production, as I'm sure you will accept, but underneath of that, there's been an awful lot of duck paddles that have been moving very quickly, mostly by Social Work England, so we're very grateful. And lastly, to point out our gratitude to the participants of the study who gave up their time when they were already incredibly busy, and the young advisors that have been working on this study. Thank you very much, and we're happy to take questions, and I'll hand over to Gavin, who will be organizing this part of it.